maybe?
Yeah. Got it.
Wonderful.
All right, Jordan and Audrey, you guys take it away.
Okay, fantastic. Well, hello. I'm so happy to be here today. I'm Audrey Idaikkadar, and I'm the Regional Program Director at Resilient Georgia, and I'm here with my colleague, Dr. Jordan Murphy, who I'll let introduce herself.
Thank you, Audrey. Very nice to be here and talk about our collaborative work. I am the founder and CEO of the Center for Interrelational Science and Pediatrics and a community-based partner of Resilient Georgia.
Yes, and we're so grateful to be here for the invitation from the National Technical Assistance Center and also from the invitation from our partners from the Georgia Department of Early Care and Learning for inviting us to talk a little bit about our shared work. Next slide, please. So Resilient Georgia is a public-private partnership of more than 900 partners working to create a more resilient state by preventing and healing the effects of childhood adversity, promoting positive childhood experiences, and also supporting all the sectors that work with children and families in becoming more trauma-informed. Our overall vision is to develop an integrated network of behavioral health care and resources for 0 to 26-year-olds and their families across the state by empowered by a coalition of trauma-informed organizations. And in our work, we strive to be as preventative as possible and to intervene as early as possible so that we do not have to be reactive. And so for that reason, we're so grateful to have the opportunities to partner with the Georgia Department of Early Care and Learning, to participate in the Georgia's Infant and Early Childhood Mental Health Task Force. And I will describe a little bit about our work that we've done to reach out to early childhood leaders across the state, as well as to support the ECE workforce. Next slide, please. Thank you. So our 3 pillars of our work is to connect and convene, celebrate and share innovation, and also to remove barriers. And one of the ways we connect partners to each other and also celebrate and share their work is through the Trauma-Informed Training Roadmap. So this is a roadmap that consists of over 100 trauma-informed trainings that our partners and our coalitions provide throughout the state. They're categorized by sector, including the early childhood education workforce, and they're also categorized according to the 4 levels of the Missouri model, whether it is trauma-sensitive, trauma-aware, trauma-responsive, and trauma-informed. And then I also wanted to share one of our communication tools. These are learning cards where we have shared key mental health terms and resilience terms and why they matter. These are available in 12 different languages, and we've co-branded them with many national, statewide, and regional partners that have then also shared them. So this is to help establish a shared understanding of ACEs and what it means to be trauma-informed. Next slide, please. So the program that I support is our regional coalition program. So we have 16 regional coalitions that cover 120 counties in the state, and Georgia has a lot of counties. So that means only 75% of the state so far, but we plan to cover the whole state within the next year. So each of our regional coalitions have developed a robust public-private partnership, and they're all deeply engaged in their work to reduce mental health stigma, prevent and heal childhood adversity, emphasize trauma-informed awareness and care, promote system of care coordination, and also to promote resilience in children and families. And they do this by providing education, teaching, and training, supporting workforce development, advocating for and strengthening policy, and engaging in research. So next slide, please. So in 2021 and 2022, we received the Preschool Development Grant from Georgia DeCal to support IECMH initiatives. So our regional coalitions convene partners within their area to facilitate infant and early childhood regional planning sessions, where they identified SMART goals to achieve within the next year. So some of these goals included social media campaigns, providing trainings to ECE staff in their region, or signing up families and Head Start programs to book programs. The coalitions also worked with partners like Dr. Murphy to offer Community Resiliency Model trainings and Mindful Self-Compassion trainings, with the purpose of engaging IEC stakeholders. And in addition, we also worked with subject matter experts and DeCal staff to create a resiliency zone guide for early care and education centers. So across our 16 regional coalitions, there is a documented need to support the early care and education workforce. As Jamie spoke about earlier, early care teachers have often felt very stressed, experience high burnout rates, and the pandemic added additional stressors that have caused those rates to intensify even more. So community resiliency model trainings and mindful self-compassion trainings provided these leaders and teachers with the tools to help recognize and support their own emotional well-being, so that they can continue to be leaders, and also the tools to help promote the emotional well-being of children in their care. Coalitions considered the schedules of the teachers and the centers when organizing trainings. Trainings were held both in person and virtually and during non-traditional hours like the weekends, lunch breaks, and evenings. The trainings and events included incentives like door prizes and food, and teachers were also able to earn continuing education credits for the training. So here on the slide, you can see the number of the folks trained, the number of organizations touched, but I also wanted to share that these trainings and events help build relationships that have gone beyond the lifetime of this grant. So for example, Resilient Middle Georgia invited the largest pediatric practice in their region to one of their trainings. Unfortunately, they couldn't come, but that began a relationship that they didn't have in the past. And now that practice works with this coalition, and they become the first trauma-informed pediatric practice in Middle Georgia. Our coalition has provided trauma-informed trainings to all the staff. They've added a social worker and an MFT intern to be a part of their office, and they've also adopted a nurse call line for mental health concerns. And with that, we can go to the next slide.
All right, well, thank you, Audrey. So I am, again, part of the Center for Interrelational Science and Pediatrics, and we are just one partner in the entire state that works really closely with Resilient Georgia. And I want to just expand on one of the trainings that Audrey mentioned, and that's the Community Resiliency Model, and how we've used it particularly for early care and learning settings. So as one of our initiatives, we promoted this approach, and it's called Bridges to Therapy. And it's an innovative approach for addressing pediatric behavioral health using the Community Resiliency Model, and I'll just call it CRIM for short. But one thing that we've been really working really hard to do, as you heard earlier in the presentation, is support the workforce, but also support the children with developmentally appropriate wellness skills, which are a part of CRIM. And these skills, they work across the lifespan, but they do have to be adapted. And we've had much success using this model and this approach across the state, but really particularly with early care and learning providers. So I'll talk just a little bit about how we've used the Community Resiliency Model. Next slide. So between 2021 and 2022, we were doing general community resiliency model trainings, pretty much for anyone who was interested in attending a live online workshop. It was skills practice. We were all engaged in wellness skills for self-care. We were hoping that individuals would, of course, use it within their fields, early care and learning, healthcare, et cetera. What we found is that one of the top two groups to attend those trainings were educators. So we thought that that would be just a great opportunity to expand the offering by also adapting it to the early care and learning settings. So with that in mind, we decided to push for an infant and early childhood professional development course and guidebook. And essentially what that means is we have worked through developing a learning platform, an online learning platform, where we have about 13 different topics presented by 8 different faculty from all different fields. So healthcare, education, social work. We've gathered them together from all of the universities, again, part of that building that partnership, and invited them to just give of their expertise and knowledge in these development courses. As a second component of this professional development course and guidebook, we still offer the live trainings. We think that's such a central part of learning. So not only listening through online courses, but also working with a community resiliency model teacher, a community resiliency model trainer to provide that direct access to wellness skills training. Again, we promote this for self-care. We want our staff and our early care and learning providers to feel supported in the work. And then we also make the workshops and trainings fun and interactive so that they can use them with the children. So as you can see on this slide, we have a few samples of the courses that we have available so far. So we cover topics that range from the brain and the autonomic nervous system. We talk about trauma and memory. We talk about wellness for early childhood professionals. We cover some theory to provide a really good foundation for this content, and also healthy relationships. We've developed a really fun curriculum where we pair these wellness skills of the community resiliency model with art. So we collaborated with a local art therapist to develop a really fun interactive course that can be used in the classroom. So just to kind of sum up our approach, we really are working hard to not only strengthen relationships between organizations such as SIS, as well as Resilient Georgia, but we're really working to promote wellness skills and access to online professional development for early care and learning providers, and adapting wellness skills that can be used to support the social and emotional development of children birth to 5.
Thank you guys so much. I do have a couple of questions though. So the development course and guidebook, do any of those translate like to CEUs for professionals, for therapists, pediatricians, things like that?
Yes, just a few days ago, all of our courses were approved for clock hours. And at this point, we have about 10 and a half hours, total hours that are available for clock hours.
That's awesome. And they're all free?
Yes, the entire training is free.
Wow. Okay. So you also mentioned doing some in-person trainings. Are those free as well?
So they're live and online, but those are free as well. We host about 2 trainings per month of the Community Resiliency Model wellness skills, and staff can come in as their schedule allows and just practice the wellness skills with a CRIM trainer.
Do you have any idea how many staff have been through these trainings so far?
So we actually, for this particular approach, this month will be our first trainings. However, we've been doing this over the last few years, and educators have been one of the top 2 groups that have showed up for these trainings. And we have lots of great feedback from how they've used the skills for self-care.
That's great. So Audrey, can you, and you may not know this, you may not be the right person to ask, but can you talk a little bit more about forming the community partnerships, like how you guys decided who to partner with, who to reach out to? Is that part of it that you actually were involved in?
Sure. So when Resilient Georgia first started, we started with 40 partners at the table. And I think I mentioned earlier that now we have more than 900 partners and stakeholders. And really, we want to connect with anyone who is supporting behavioral health for 0 to 26-year-olds and their families across the state. So with the regional coalitions, we started working with them in groups. We have 4 cohorts. So we started working with them in 4 groups. And the first cohort, I believe, started working with us in 2019. And it was really the groups who might have already been doing this work or were really great conveners. And if you look at a coalition map, you'll see that the geographic area is very different depending on where they are in the state. So like, for example, in the metro area, it's usually 1 county is a regional coalition, and that's partly because of density, or that is because of density. And so there's some regional coalitions that have 13 counties. And so really thinking about what are the natural relationships that are already occurring in terms of like what counties are clustered together. And our coalitions many look very different from each other. Sometimes lead partners are the United Way. Sometimes they're an organization called the Family Connection Partnership, which is here in Georgia. And so it really depends on, there's a lot of variability, really. I don't know if I answered your question quite.
You did.
Okay.
Yeah, just mentioning some of the different partners, I think, makes a difference as well. So what kind of funding? Is there any blending, braiding, layering of funding in this project?
Yes. Yes. So everything is a public-private partnership. So we work with, so there is foundation funding. We also apply for state grants. We also apply for other funding. So all of it is blended and braided. And when we work with regional coalitions, we also ask them to also do the same, identify different funding sources to do this work. And that's, I feel like that is a part, like a core feature of the work that we do.
I agree. I would definitely agree. So they have some skin in the game. Yes. So this question is for either of you. What kind of challenges have you faced and how did you overcome them?
And it's a good question. So I think that, and I've shared this before, and the regional coalitions have shared this with us, but that working, actually, it's been, the coalitions often feel challenged in connecting with early childhood educators, but I think that they've also created really novel ways to connect. And that's why I mentioned that earlier, where they create events that really tailor to schedules. Offering continuing education units is such a huge incentive to be able, for folks to be able to take the time to take this training. And that's one of the things I'm really excited about the CRIM course that Dr. Murphy described, is because they can be taken on demand and fit into where they fit into someone's schedule, which I think is also very powerful.
Yeah, I think we've all gotten so used to that through the COVID years, that when somebody requires you to like be somewhere in person, you're kind of like, wait, we always get, is there going to be a virtual option? Like we have a national convening that's going to happen in December. And one of the first questions we had was, is there a virtual option? So yeah, I totally get that as well. So Jordan, I think I wasn't sure, are you, is your center, do you actually have a pediatric practice in your center? Or I just wasn't real sure, like it's a very innovative name. So I wasn't sure if there's actually a pediatric practice associated.
Yes, so I do have a nonprofit that does direct services for children and families. I'm a pediatric nurse practitioner, so I spend part of the week seeing patients. The other part of the week I spend doing training, such as the Community Resiliency Model. So really kind of combining that dual approach of training the workforce, but also providing direct services as well.
Excuse me, how do you feel like having this training makes a difference in the services you're able to provide?
Oh, the community resiliency model has really transformed how I practice because I do specialize in mental and behavioral health. However, CRIM, the wellness skills are really the #1 intervention I use, which is actually why we chose to describe it as a bridge to therapy. So considering Georgia and knowing that we often have challenges, even just in talking or describing mental health, one thing that has been really helpful is to use a wellness approach, learning skills for self-care, and then opening up the conversation, talking about the biology of the nervous system, how we normally respond to stress, and then using that as an entry point to higher levels of care when needed. So this is actually my entry point to providing mental health and wellness skills.
Do you feel like it's really making a difference with parents? Like, do you start by talking with parents about like what you observe, and how do you figure out that there has been some trauma? Or how do you figure out what sorts of services families might be open to? Because I know as a professional, already probably after a visit what they're going to need. But we hear a lot about how people don't really connect the words infant or early childhood with mental health. So how do you really go about helping parents understand that? Are there screeners that you use that help them identify trauma, that then they kind of understand where you're coming from?
Yeah, those are great questions. It usually depends on how the parent presents. So I have some parents that say, I believe my child has this based on these behaviors. So there may be some education and then kind of guiding the conversation toward a prevention or a promotion or even a treatment approach. There are other parents who have experienced their own trauma, and it's impacting the household, it's impacting the family. And so some of the behaviors are in response to things occurring at the household level. So working to get parents the appropriate treatment and referring them out for treatment if needed, but also really supporting the family. So CRIM is a model that works in your primary care offices, your early care and learning centers, your households as well. So it's all adapted and useful depending on how families show up when they're seeking services.
That's great. Audrey, is there any hope that this will extend into school systems and be somewhat appropriate for older children?
Yes, so I think it is already being shared and implemented within school systems and for adults, and lots of different folks have participated in community resiliency model trainings, and also in lots of different sectors, including teachers of K through 12. So earlier I described how we developed a resiliency zone guide for early childhood educators and centers, and there's been a lot of interest in also implementing those practices and a space to develop regulations to be able to self-regulate, and a space to help calm down in schools and in lots of different types of spaces, like in courts. And so yes. Yeah.
That's going to be a really big benefit of it, I feel like, especially having online access. I think that's going to be great. Are you, do you guys work with the DFACS offices in counties? Are they involved in this in any way?
Yes. So just like Resilient Georgia connects all the different partners, our goal is to connect all the different partners across the state that's working to support behavioral health of 0 to 26-year-olds and their families. Our regional coalitions are doing that as well. And so there are those connections locally to different DFACS offices.
Awesome. I don't think I have any other questions. Is there any information that we didn't get to that you guys would like to share? Maybe, maybe not. Y'all shared a lot of really good information, though. I think this is really unique. And I think that as people go back and watch this, we're going to get some additional questions about what you guys are doing. So thank you so much for doing your presentation today. I really appreciate it.